ABC7 Town Hall series, our Chicago Voices of the Community. I should mention, first of all, that I'm Alan Kraszewski, ABC7 news anchor and reporter here, and I'm your host for our town hall this week. And we have a very important conversation dealing with a matter that I know concerns all of us, as we've been dealing with COVID-19 now for more than a year here in the Chicago area and, of course, nationally. But there have been many, many questions and justifiable questions that people have had regarding how do COVID-19 vaccines work? Are they safe? Should I receive one? And beyond that, historically, there are issues within many cultures and communities here in our Chicago area that have led some people, quite frankly, to be a bit reluctant, even to accept a vaccine, or beyond that, to wonder just what is the truth when it comes to COVID-19 and what are the best steps forward in handling it. So we've got some excellent panelists who are joining us today to shed some light on this from some different perspectives throughout the Chicago area. And I'll start first by introducing Mr. Justin Lombardo. He is with the Archdiocese of Chicago. Give us a wave, Justin, just so we know. Okay, there we go. With the Archdiocese of Chicago, he is the Chief Human Resource Officer for the Archdiocese and also lead of the Archdiocese COVID-19 Task Force. A little bit of his background: he was appointed the Chief Human Resources Officer for the Archdiocese in early September of 2020. He was already serving, though, as a leader at that time in the Archdiocese's COVID-19 Task Force. But he has 30 years of working experience as a human resources executive, focusing on a number of topics, including workforce learning and development, high reliability teams, performance management in healthcare in particular. And he also served as vice president and chief learning officer for 3 hospital systems across the United States. He's also served on advisory boards at the national and international level as well. So great to have you with us. Justin will be with you in just a minute, of course, with our questions for you. And also I want to introduce Rabbi Wendy Gephan. Rabbi Gephan, thank you. Thanks for waving for us. Rabbi, we appreciate that. She is the senior rabbi at the North Shore Congregational Israel. Rabbi Gephan was installed as the 9th senior rabbi of NSCI. That was in 2015, and has been part of the rabbinic team there since 2002. She is a tireless leader of the community there, a person who people turn to, quite frankly, for wisdom and counsel, education, and insight year after year. She has a vision for NCSI, which is reanimating and redefining what a 21st century synagogue can become, synonymous with thriving and transformation, developing relationships of significance, and a larger sense to a purpose and impact in repairing the many areas around the world that we all need some fixing. That's for sure, Rabbi, right? All right. I also want to welcome with us today Dr. Bishop Horace Smith. Great to see you there, Doctor. Thank you so much. Dr. Bishop Horace Smith is pastor of Apostolic Faith Church in Chicago, and that is a dynamic 4,000 member ministry dedicated to serving the natural and the spiritual needs of the local community, as well as supporting missions of many types and aid efforts all around the world. His belief in God and healing extends to his medical profession as an oncologist, having treated bodies and souls for over 40 years now. That's great, Dr. Bishop. He's recognized worldwide, in fact, in his particular fields. He's, of course, the pastor, as I mentioned, of Apostolic Faith Church, but also an attending physician who specializes in pediatric hematology and oncology at Ann and Robert Lurie Children's Hospital of Chicago. Dr. Bishop, it's great to have you with us today, this afternoon as well. I also want to mention, too, that we're expected to be joined here by another guest today, and that's Gregory Abdullah Mitchell. Mr. Mitchell is the executive director of the Council of Islamic Organizations of Greater Chicago. So hopefully Mr. Mitchell will be joining us here along the way, and we'll be sure to introduce him more formally whenever he has a chance to join us. But let's get right into this, if you don't mind, with my guests here. And I'm going to start, Justin, let me start with you. There have been a lot of questions when it comes to Roman Catholics in particular with regard to whether they should be accepting of the vaccines that are currently available. There's been information, and I think you'd agree there's also been misinformation out there to the point of where Pope Francis has even had to clarify some of this. What I'm getting to here is the hesitancy perhaps on the part of many Roman Catholics to accept a vaccine where research was done, at least initially, on fetal cells that came as a result of abortion. So can you shed some light on this? I know Cardinal Cupich has spoken out on this as well. So go right ahead, please. Thanks, Justin.
Thanks, Alan. And I'm so pleased to start with such an easy question.
Yes.
Actually, you're right, Alan. It is. It has been a question that was raised. It has resulted in misinformation and information, but you hit on it. In the minds of most Catholics right now, the issue is settled. It's a settled matter. The Holy Father, as early as last March, spoke out about the vaccines and called it a moral act, a moral requirement of faith. That one that we do not act alone, and we have a moral obligation to protect the life of not just our own lives, but the lives of everybody else. Again, as early as recently as Easter Sunday, the Holy Father spoke about making the urgency of making the vaccine available to everyone, particularly in underserved countries and communities, and the moral obligation to make that happen. He called it at that point a choice that one must do it. That was his statement. I think you go further than that. Our own cardinal, who obviously I have nothing but the greatest respect for, positioned it as an act of love. And if you think about faith, and I'm sure my colleagues here would agree, that you boil it down, that is the most important thing to consider. We as people of faith, we don't act in isolation. There's not one faith tradition that's represented here or anyplace else where humans act in isolation. We act as community. And as community, our tradition says we look after each other. We take into account the weak and the poor, a settled question. That the good of the vaccine outweighs any potential moral liability.
Now, there was, I believe, correct me if I'm wrong here, there was a bit of, and I'll call it finesse here in terms of from the church itself as to, from a Catholic standpoint, that there might be some vaccines that might be more morally acceptable than others. And if I understand this correctly, it seems to be perhaps to what degree they relied upon these fetal cells. I guess they did it through their testing all at one point in time, but perhaps to what degree their development relied upon them, or whether it was long ago and now
and that's the key.
Yeah.
Alan, I'm sorry, I didn't mean to interrupt you, but
No.
you hit on the key. The trail of the cells is more than 50 years old. And the dynamics of the argument is that there's no proximate moral ill. And that's the key. And I see my brother and sister are nodding yes. And I believe they believe this too. There is no, and by the way, you are my brother and sister. We are in this together as communities of faith. That there is no moral ill. So the finesse there was one of saying, okay, on a scale of, this one may have had some tests in it early on, but not. But the final line in all the argumentation around this was, however, whichever one you're presented with, get the vaccine. And that's the final most important line.
Thank you. And I want to allow the two of you, and I appreciate so much. Actually, I enjoyed watching the three of you talk as Justin's talking, and Rabbi, you were nodding at times, and I know Dr. Bishop Smith, you were of course in agreement as well. So it's wonderful to see that there are issues that we come together, and I don't mean just a singular one, but many issues we come together in terms of solidarity and where we stand. Dr. Bishop Smith, let me ask you, in the African American community, and for that matter, even in many communities of color, there have been a lot of questions and, quite frankly, hesitancy, and for good reason, some people might say, even in terms of the things that have happened historically to those communities, even at the government acting to cause things against them. Are you seeing that? Do you see it still, first of all, and how do you try to address that? I just want to pause for just a second. Bishop, I think you might be muted. Make sure your microphone is on.
Well, I'm rarely muted. Yeah.
There you go. There you go. Thank you.
Yeah, it's happening for sure. Let me give a couple of illustrations. You alluded to history. The history that is most often alluded to is the Tuskegee Experiment, right, where African-American men who were known to have a certain disease, syphilis, were not told they had it. And when there was treatment available, they were not treated for decades. And that was a public health, government-sponsored program. And having said that, it was 70 years ago. Since that time, because of the safeguards in medicine, IRBs, which are institutional review boards, that you cannot have any experimentation without community involvement. You have to have isolation of a person who runs the studies versus those who are available who know about the studies people can turn to. So that cannot exist in today's situation. But having said that, I think the more telling issue in minority communities is what happened. I remember back in March when COVID really began to hit us very hard. And I heard people saying things like, boy, I wonder why so many African American Hispanics are getting COVID. And I said to myself, why are you surprised? Long-standing, decades-long health inequities is the major issue which underlies hesitancy because people have not received proper access to care. They have not received quality of care. They have not received the kind of care they need. So chronic conditions in these communities are rampant. And of course, all COVID did was to telescope even further these inequities. And so right now, 2 to 3 times the number of African Americans and Hispanics per capita are dying from COVID and having severe COVID because of underlying health inequities. And that means that those communities have a suspicion against the majority health community that we need to dispel with proper information to say to them, here's why these vaccines are both safe and effective. And here are the safeguards that you don't have to worry about because we've looked at them in some detail.
I know we've seen, of course, and let's talk about the city of Chicago in particular, and I'm talking about the mass vaccination sites, for instance, at the United Center. You're well aware of how, and there was been controversy about that. I'm talking about when they said, hey, you know what, we have zip codes here on the south side in particular, and on the southwest side too, again, largely African American and Latino areas, where we know that the incidence is so much higher that we have to get these people in here as fast as possible. And there was some pushback from others regarding that, say, hey, what about us, essentially, I think would be the simple way to put it. So what is your thought now as to where things stand? And quite frankly, whether what is being done right now is sufficient or is somehow answering some of the issues? It's a huge issue, I know, but some of the issues that you mentioned there.
I think it's a huge issue. I think both the state government and the city government are trying very hard to make sure they address the issue of justice in vaccine accessibility and allocation.
Yes.
In the faith community, all of us hold very dear these ideals of equity. And so I pointed out some months ago that if 72% of the deaths from COVID in Chicago are minority deaths, then in a very simplistic way, then the 72% of the first vaccines should go to those populations because they are at the highest risk. That's not a racial issue. That is a human issue. We know that in medicine that those who are most vulnerable deserve the best care because they are more vulnerable. So I think that the city has used it as an earmark, equity. So has the state. Now, in practice, has it all worked out well? Well, again, there are different views about that. There were instances that when certain zip codes were allowed more vaccine, persons from other zip codes who had access to it showed up and got those vaccines. So, in theory, it can be is equitable, but it isn't. Think about this. The way you get the vaccine, by and large, has been through your healthcare provider, or it's through using technology that many of these communities don't have access to. The other point, especially in the Hispanic and other communities, if you are not a documented immigrant here in this country, you may have reluctance to identify who you are, even though you need the vaccine. So there's a lot of complexity. I think people are working hard toward that, but we can do a better job. I'm seeing now there are more sites being opened in houses of worship. In the next few weeks, you're going to see that, where a community that knows the people have some guidance in who has access to it. And again, to ensure that the most vulnerable get vaccinated. So yeah, it's complex, but I think we're making headway with it.
Well,
Yeah.
that's encouraging to hear. I know it's not a simple answer. Rabbi Gephan, I want to get you into this conversation. Forgive me for I wasn't letting you
Please.
out of it until
Mhm.
deliberately. But let me ask you this in terms of, and I'm going back to what Dr. Bishop Smith just said too, which is now it's getting to the point where the administration points of the vaccines are in the communities. In other words, somebody from the South Side doesn't have to go the whole way to the United Center to get it, but and they may hopefully be getting the administration of it from somebody that they trust to begin with, whether it's a local congregation, a synagogue, whether it's a church on the South Side, whether it's their parish, whatever the case might be. I don't know to what extent you're seeing that, Rabbi. Is that happening now?
So yeah, I mean, as I understand it, I mean, I know that from speaking with fellow clergy, both locally in the community where we serve, but then more broadly across Chicagoland, there's been a desire to serve that function really since the beginning of the news of the vaccine. We're just getting to the point, I think, where there's enough inventory, as it were, to really sort of begin to spread out. I know that's a source of frustration for so many, but at the same time, you know, it's pretty miraculous, actually, that we now are in a position to imagine that any adult who wants the vaccine could get it soon. And the idea, I think the point or the relevance or the importance about why a house of worship might be a space for distributing the vaccine is exactly that idea of the value of trust, the value of community, the value of home, the value of relationship. Because at the heart of this, and I think it's why you have three sort of people who navigate the realm of spirituality here today, you know, the vaccine isn't just a medical choice, it's a communal choice, it's a values choice. And all of our faiths, pick a faith system, whichever one it is, any of them are going to be aligned around the idea that we are our brother's keepers. We're not just our own keepers. You know, we are responsible for each other. And the vaccine, sure, it benefits me, but it also benefits others. And if we can, you know, I hope that all of our houses of faith embody that idea all the time. And so it makes total, at least in my view, it makes total sense that people would be able to seek out their trusted place of worship or community to participate in, I think, what really, in my mind, is a holy ritual. I would imagine that my colleagues here feel the same way, but it is a life-saving experience. I remember when I got my first vaccine 2 weeks ago, I was brought to tears by the person giving it to me. And I said to her, I was like, you maybe just saved my life. You know, you maybe just saved someone else's life. You know, it's holy. You know, that's the language. It's not medical language, but it's the language of the spirit. And I think in that sense, it's a perfect fit.
Yeah.
That's fascinating. I'm really kind of drinking in a little bit of what you just said there, and I think it is so true. For first of all, let's just take individuals who believe that this is the right thing to do, and they're eager to receive the vaccine, and in fact, in some cases, one could even argue desperate to receive the vaccine. That when they do eventually receive it, they not that they have total relief, but there is an experience, like you said, of the person who's administering this. How many times it would almost be interesting to hear them say, "Oh my goodness, people thank me so genuinely and wholeheartedly for what I'm doing," which is such a simple act and yet such an important act. And I'm almost struck at the same time how we have that, okay, and I don't mean just on one side, but that's one dimension of this. And then at the same time, you have individuals who are saying openly, not me. I'm not getting it. No way. It means harm to me. You name it. I mean, there's this. We don't have a representative here from evangelical churches per se on our panel right now, but let's talk about the Pew study recently, that in a survey, and in particular of white evangelicals, who so many of them were saying, "Oh, there's no way. This thing. I mean, you name it. There's all kinds of reasons people give. Everything from I'm being chipped, or this is the mark of the beast that's spoken of in Revelation. I mean, all kinds of things going on here." And I'm just curious to hear, if I throw that out at you, how you balance that. And it does show obviously how almost every issue we could think of becomes so politicized in our country right now. But how do you answer that? I don't know who wants to jump in first. Feel free.
Well, I just toss in, if I could, around that. I think that's where it comes down to walking in faith. So it's not just the preaching moments of faith, it's the walking in faith. And I think, Alan, if they see all the brothers and sisters of faith communities walking together to do this, to bring the vaccine to people, to extending their own arms. I mean, there was a study 2 or 3 weeks ago, I think it was before the Pew study, that actually looked at and talked to vaccine hesitant, which, by the way, we need to position this vaccine hesitancy issue. This was identified by the World Health Organization as one of the 10 most critical healthcare issues back before the pandemic. It was identified, vaccine hesitancy was identified, and I believe, and Dr. Bishop, you may know, I believe it's 2019 by the WHO as one of the most critical healthcare issues. But if 3 or 4 weeks ago, they did a focus group with typically individuals who were significantly vaccine hesitant and typically white males, and they were less than college educated. And they came out, and one of the things they said was they didn't want to see celebrities. They didn't want to see celebrities making PSAs. Didn't want to see it. Wasn't useful. What they wanted was people they trust and doctors that would come on and say, I got it. Okay. Showing people getting it. Talking about, one said the most convincing thing that he heard was when this physician came on and said, I've gotten mine, my wife has gotten hers, and my 2 adult children have gotten it also. And that posed them to stop and think. I think also seeing large communities of faith acting together. We've been in, with the Archdiocese, we've been in a faith-based alliance for school vaccinations for our teachers between Agadah Israel, which represents a significant portion of the Orthodox community, the Missouri Synod of the Lutheran Church, and ourselves. And the power of seeing thousands of people of various religious backgrounds going into the Joan Dax Orthodox Jewish School on the north side to get it has an impact. And you see then numbers of people from the African-American community from schools coming in and doing this. I think that begins to send a message that your fear can be alleviated when they see it in action. But I don't know what my colleagues think.
And let me just jump in and say, and I want to hear from both of you, Dr. Bishop, as well as you, Rabbi, as well. Obviously, if I don't know your individual situations as to whether people are meeting in person or not in your worship facilities. Maybe they are to some degree, or perhaps they're not at all. Maybe they're still online. But how have you addressed that? I'll start with you, Dr. Bishop. How did you address that, or do you address it, even in a pastoral way within a service or within an informational area? How are you doing it, and do you see effectiveness in terms of that message getting out?
Yeah, I think the rabbi gave us the key. Healthcare is always a trust issue, always. I have friends of mine who have physicians who've been trained at Harvard and Yale, and they'll go see their doctor, call me and say, hey, Horace, what do you think? I'm like, why are you asking me? Well, because they know me. No, it's relational. They say, you're going to tell me the truth, even though they have the best of the best. So we should be clear about that. Choices in healthcare is like access. You can live next to the university, but if you don't trust them, you're not going there until you're almost dead, because it's relational. So you can understand with COVID and all of the misinformation and the politicizing, people like, boy, I don't know what to believe. And so again, trusted voices that that you're in long-term commitment to, you trust them. So when our church becomes a vaccine site, people are going to come, oh yeah, I'm going down there, because they trust. But you can understand in other communities where there's not been trust, we should not judge them so harshly, because they have learned over the years not to trust. I think that this epidemic, this pandemic, should be a teaching moment for going forward.
Yes.
If we don't change the way we're doing things after the vaccinations are all given, everybody's vaccinated, if we don't change, then we've been less than genuine. Because again, these are long-standing dynamics that we have never addressed, except in the acute moment when 500,000 Americans have died. So we've been motivated. But I'm saying that this issue of commonality, this issue of trust, of connecting together and believability, we have to begin to inculcate that into our institutions and our systems. They have been lacking before now.
Rabbi, please. Thank you. Thanks, Bishop. Thank you.
I was just going to add, in my experience, so I've actually had COVID. I had it in January. Thankfully, I wasn't hospitalized, but my family and I had it, and it was a most unpleasant experience. And more than that, I've had the traumatic misfortune of walking a number of our families through the road, in particular of death from COVID.
Yes.
In particular, early on, when the way people died was, I don't know how else to say this, horrific. Alone, terrified. Their caretakers, who were angels in hospitals, didn't know what was happening. I mean, it was terrifying. And I sat at cemeteries alone. I buried a World War II veteran who liberated a concentration camp. And he died and was buried alone with simply me at his graveside with his family on a cell phone from California. And what I've found, I've actually encountered in my community, people who are hesitant or really against the vaccine. And I don't try to change anyone's mind. What I try to do is share the truth of my experience. And I say to them, I just want you to understand this other place from it. And I found that creates a little more space, a little less defensiveness, and potentially opens a door. But it only comes through the fact that we know each other. It wouldn't happen without that, to the point of, I'm sure that for some, seeing a celebrity is meaningful and motivating. I don't want to discredit that, but there is something so much more compelling to the interpersonal, known, shared communities. And at the same time, we might not be able to change everyone's minds, but we do, as people of faith, I believe, have an obligation to do whatever we can to create whatever sort of safety nets we can for the larger community. And vaccination is a great example of that. The more people who get vaccinated, the better it will be for everyone. And I care about the people who are anti-vaccine. They're fellow human beings, fellow children of the same God, as I think the three of us who are panelists today would likely say, right? And so it's my spiritual obligation not to reject them, but actually to understand that I can still help in this, the individual can be a weaver of this web. And bring everyone along one way or another. I think if we don't start to understand and expand our tent of inclusivity, I don't know that the divides that plague us, in fact, maybe I should be a little more assured. I do know that the divides that plague us will not be brought back together. Someone has to be the weaver. And as people of faith, why wouldn't it be us?
Yeah,
I'm encouraged personally just to hear what you're saying, all three of you, really, honestly. I'm just kind of drinking it in a little bit. I wonder, and I'm sorry, Dr. Bishop, please, I'm kind of, and let me have you address this. We've talked so much about the long-term inequity that has existed and the long-term now suspicions and the politicalization. What the three of you, it's fascinating to watch your reactions because I see your heads not in agreement with each other. In some cases, bringing your hands together in support of when somebody says something. It's not always that case. I realize that, and it perhaps never will be. But how do you reach out to other people who are in the same interest, I'll call it line of work, in the same areas of ministry? How do you come together more to be that change and the people that you're dealing with directly, to encourage them? I know it's not just you, but as from leadership positions to encourage those who are in your congregations to come together and really be a part of this long term?
I think you have to show the human side.
Yeah.
In this year of pandemic, as I prayed about, what is the message we should get from this pandemic? And I really feel this. It sounds kind of sophomoric, but I think that we've forgotten our common humanity.
Mhm.
We've forgotten that.
Amen. Amen, brother.
What affects me in the African American community, in the Hispanic community that is already marginalized, if those needs are not addressed, eventually we're going to all suffer. We've got to understand we are so connected, and we need to acknowledge that. I think it's even ironic that the people who are most marginalized have the highest hesitancy about the vaccine. So it's quadrupled and doubled, the ones who are not getting vaccinated are those who need it the most. And that's being perpetuated by misinformation. So coming together like this, it's a shame that we have to nod together on these kind of shows. I just had a meeting last week with the Asian American Christian leadership in our city, and African Americans, because of the increase again in this anti-Asian violence. Well, the fact of the matter, we discovered together that this has been going on for a long time, but the Asians have been couched as the model minorities. So they've had incentives not to protest. Now they realize, hey, we're vulnerable too. We're all vulnerable. In a nation that it is the greatest one on the planet, there is a tendency to ignore the fact that the history of our country has in many ways perpetuated people being less than. That's not my view. Those are the facts. And until we begin to talk about as leaders like this and say, hey, what's happened in our country about racism, it did not start with George Floyd. It's been going on for decades. But because of iPhones and other technology, now you see it in the moment and go, oh my God, what's going on? I'm saying this, we need to, as leaders across denominations and faith and everything, say there is a human value to every person. We've got to, as Justin said, walk that in faith, not talk it. We're good talkers. No, walk it and make sure that people are affirmed in their day-to-day life. It is much easier than to deal with a pandemic when we know we're in it together.
How do we get people to become more of that? How do we get more willingness for people to open their eyes and see the we instead of us and them? How do we do it?
Well, I think Rabbi said it in the way she was talking about it, and I think the bishop alluded to it too, Alan, is this is not a time for us to be judgmental with each other. This is a time when if you run into someone who's vaccine hesitant, who doesn't, and we run into it, our churches have been open for several months under very strict guidelines, required masks and things like this. And one of the things we had to navigate is if somebody comes in without a mask or tries to violate it because they quote unquote don't believe in the masks, that your first obligation as a member of a faith community is to not fight them. It's to say, to talk to them, lead them to the science, to gently try and lead the way and examine it. But if you immediately go into an us against them kind of modality at that point, you've lost it. You're not going to move them at all. And to Bishop's point, you've lost whatever incipient trust you've had because you've now made it adversarial rather than communal. I go back to a line that Pope Francis has used probably in 8 different audiences. And he does it a lot with the press when they try and pigeonhole him into things. He'll come out and say,
we don't do that, do we?
Oh, look at the bishop nearly passed out when he heard that. But one of the things that the Holy Father has said, he'll shrug and say, who am I to judge? And in terms of demonizing individuals, rather than trying to work with them and educate them and say, I will walk with you through this, is a real big difference. I mean, and Rabbi, I really appreciated when you talked about that. It's like pull people in, not exclude.
Can I just add one other sort of idea into the conversation, which just so resonates, is, I think on the one hand, the pandemic has exacerbated our sort of siloed existences, because we literally have been locked in our existences, and we can customize our existence. And in some respects, the best way to create trust, or our most sort of desired comfort zone with trust, is in the existence that we cultivate for ourselves, right? So it sort of mitigates against, so how, we're not living at a time when it's really easy to like bring 4 different big communities together in person to, walk hand in hand. And at the same time, I do believe that we have, even with technology, the ability to walk hand in hand, certainly differently, but we can actually all be in our own existences, but also be together, not to try to convince anyone of anything, but simply to share our truths. If someone can share their story, that's ultimately what's most compelling for any listener, is just to understand the truth of someone's existence. I honestly, I think like for much of the white community, they had no awareness of the Tuskegee Project until this vaccine controversy. But that's an opportunity to begin a conversation that would have never had any resonance in the communities like mine that needed to hear it.
Yeah.
But now we do have the opportunity to engage together, to share together differently. And I think it's just about kind of switching our mindset a little bit, utilizing what is at our fingertips to create shared, diversified, common spaces where people can build trust in more expansive ways. Because, people who know me might not know Horace or Justin, but because we're together and we now know each other, they're more likely to trust Horace or Justin when they see them in some other environment. And I think it just all goes back to that idea of modeling the relationships. In this case,
makes so much sense.
Good talkers, but we're walking too, I think.
But but Alan asked a question. I think he was trying to be that typical news person, saying, and we kind of sidestepped it.
Which is our job, Bishop. That's our job.
Thanks for coming back, Bishop.
The hard answer. Dr. King was killed over 50 years ago. We all are aware of this. He said that the 11 o'clock hour on Sunday morning is the most segregated hour of the week. So, Wendy, you said something. We are in our silos, and I understand the pressures of life every day. But if we don't at least take from this pandemic the urgent need that we had better create forums like this.
Of course, yes.
We are seeing once a quarter doing something together that crosses all of the denominations. We've got to do that because that creates the integrity of our words. If we just say it now because people are dying from COVID, we just do it now because we're all afraid. And then once the danger is over, we go back to our villages and we just live separate lives. Now, there may be some, difficult. It is very difficult because we're all busy. But I think that it's taught me. I said to the Asian American community, I commit to you that I'll come up with you guys a forum where we meet once every whatever, and people see us doing it. My pastor, Bishop Brazier, said, it's not enough to do good. You must be seen doing good. People should see us come together when there's not an acute issue, because that says to people, oh, in everyday life, they talk. Oh, yeah, we do. We're friends. Even though we don't have to agree, but we can be committed to one another.
Yeah, thank you. I want to jump in too, because I did mention earlier we were hoping to have Mr. Gregory Abdullah Mitchell here to join us as well from the Council of Islamic Organizations of Greater Chicago. And I'm getting the impression, I don't, maybe he had a conflict in schedule, but it doesn't appear like he's able to join us. But maybe, and I don't know to what degree, forgive me that the three of you know Gregory. If you do, maybe you could shed some light here, perhaps when it comes to relationships, whether it's from Christians to Muslim, Jews to Muslims, whatever, coming together with different faith groups here, and how that may have already begun, perhaps, in terms of that cooperative effort.
I can't speak to the Muslim community, although we didn't send out, when we were looking at creating our faith-based alliance for schools, we sent out a feeler to a number of people. But I can speak to my experience working with the Orthodox Jewish community and the Missouri Synod of the Lutheran Church, which I believe also, Bishop, has a significant African American population in it. And I say this in all seriousness. I work very closely with Rabbi Shlomo Soroka and Reverend Chris Whitby from the Lutheran Church. We now, when we call each other and talk, and it's not always about the vaccines, we usually start by saying, "How's my brother today?"
Wow.
And I get choked up, but it's significantly different than before the pandemic, because they are now my brothers. I don't know if that makes sense to the rest of you, but yeah. that bond, if we don't build on it, we are denying what our call to faith is.
I agree. Even our Muslim brothers, maybe because I'm in healthcare, but I tell our young residents and interns as we train them, people are people. I've traveled around the world. I've been in so many different diverse groups. I found out that family and people are the same around the world. The fact that we don't know each other is the biggest detriment to us working together, that we become so enamored with what we do. We need to find out that here's my faith. God made us all in his image. We learned this in the Human Genome program. We're not different. It's amazing what in this country we use to make differences, which if you look at it, it's almost laughable. It really is. But our cultures have bought in to these things, and it is a damage to the human spirit. And so I'm believing for my children, my grandchildren, that they will do a better job than we have had. We as leaders have not done a good job because we're afraid of how we'll be viewed by those that we lead. And until leaders have better courage, moral courage, we're not going to see much of a difference because we're trying to protect who we are.
One thing I've noticed just among the three of you here as you've been talking, and I know it may be somewhat superficial, but I've noticed that when you refer to each other, your titles of leadership are important, obviously, very important, but you refer to each other generally by your first names, and because which suggests obviously not just merely an informality, but a relationship that continues, has already established and continues for some period of time, regardless of what issues you might be facing or whatever the people in your own specific congregations are dealing with. There is that sense of sisterhood and brotherhood that you all seem to embrace.
Can I just, I would just add into that. That's exactly what I was going to say, which is, the idea of the shared humanity among all people of faith, people not of faith, whatever their own particular identity features might be. And we don't want to dissolve those. Everyone has their own uniqueness, which is, from a faith standpoint, why it's so fascinating to think that we are all created in the image of God. Because we don't all look alike. We aren't all the same. We are all made of the stars, but other than, that there is uniqueness to us, but that's a beautiful tapestry that we all, create together. But at the end of the day, it isn't a vertical hierarchical paradigm. It's fully horizontal. We are all equals. And in the sense of, what after this, I support everything, Horace, that you said, this idea of commitments in particular. What commitments will I make?
Yes.
Now that my eyes have been opened, right? You could say before, well, I didn't know, so I claim ignorance, but you can't say now after watching. You have to have been living in a cave, truly, to not have had your eyes opened to the incredible injustices and disproportionate wrath of COVID-19, which isn't just a fluke, in particular in communities of color, for example, right? So as people of faith, we are morally responsible now, and to not make commitments would be to abnegate our faith. I mean, and it is actually that simple. At the same time, in addition to those commitments of the collaborative communal actions, and this is, Justin, what you said so resonated with me as well, I think we have to know each other's phone numbers. I think we have to be able to not, like, when someone looks to me, sure, I'm concerned about the Jewish community, but like, I have a life, I'm a person. I want the people that I'm in relationship with to know my children's names, to ask about the personal. That's how we come to value each other's true humanity, not in broad swaths of, oh, these are the Catholics, these are the Jews, these are the Muslims, but, oh no, that's Justin, that's Wendy, that's Horace, that's Alan. You know, and if I think that has to be part and parcel of the commitment.
But I think, Wendy, the commitment, and this may kind of throw a monkey wrench into this, the practical application, and I said this last week at the Asian African American Senate, we must be careful that we don't, in our sameness, require sameness from every group. Because what we do often is that we blame the victims. If we admit to injustice and inequities in healthcare, in distribution of the vaccine, then we must say that those of us who have the power are the ones who are obligated to make the difference. You can't expect those at the lowest rung who have almost no power to change.
They have no power.
What those who have the power in certain groups don't exercise, to be, it's just this thing about being equal and equitable. There's a difference in equalness and equitableness. If I've got more power, if I'm the leader of our church, I am responsible ultimately for our church's culture. And so people who have more resources and power and access, it is on them in a greater way to create the atmosphere and the ways to make these things correct.
And let me just say, if I gave any impression that I was not supportive of that, I would want to make explicitly clear.
I never had a doubt about it.
Listening, that is not what I mean. Let me just be clear. What I mean is, when we understand ourselves as human beings, not one of us can be greater or lesser than the other. But because each of us has our own reality, some of us do have more agency or power than others in different environments. And it is upon us as people of faith to be obligated to claim our power for the good. There is not the opportunity to throw up our hands and just say, oh, well, we're all equal, so I'm not more obligated than anyone else. Those are two distinct things. So thank you for calling on it. I just want to be clear.
That's good. Alan, though, I toss this back to you, because here's the thing. No, and I mean this seriously. Listening to Horace and Wendy and what little I'm doing here, but in 6 months, I would love to see the media come back and say, where are the communities of faith now?
Good.
What have you done in the last 6 months? Because we have an obligation, and we've all alluded to it. Wendy's alluded to it. Horace has, to the greater society, of which we are part, and our faith calls us to both serve and challenge and drive for good. But you have the ability to ask us to say, what have you done since this was over, to hold us accountable? And I see Horace nodding and I see
Yeah.
Wendy smiling. I mean, and I mean that seriously. I mean, I think that is part of the fourth estate's responsibility.
I like this idea, and I'll take it a little bit further because yes, I am, and I see the essence and the nature of leadership that stands up and calls for this and works with one another. But it also, not to minimize it all, and in fact to even emphasize the fact that it's got to go down to the roots. It's got to go down to the roots, so that whenever people realize, and maybe they're more educated now, hopefully, as you've said, even through going through these experiences and the horrors we've experienced over the past year, but maybe they'll realize that you can't just simply say, well, that's not me, not my problem, but because we're all in this together, forgive me for using the phrase, but because we are all humans and share this planet, and because we all should be equal, whether we are or are not in our society, that it is our responsibility individually, is what I'm saying, individually, to play a role in this, and not just simply rely on the leader to take care of it. My pastor, my rabbi, my administrator, whatever, is the one who's responsible for this. But when we're talking to our friends, when you're sitting around the dinner table, when you're online and the discussions that you enter into, but all of those things are important. But I agree with you. I'd say, yeah, sounds good. Let's see what's going on in 6 months. Let's not make it a matter of okay, it's a one-off, and there we did it for this particular moment in time. I mean, we've been through an awful lot, and we continue to go through an awful lot. Where we are, I know we're talking about many other things other than vaccines now, but man, if we, I feel like I'm talking now, or you guys should be talking. But if we don't use this, if we don't use the opportunity that we have in this moment in time to take advantage of what we have and move forward in a positive direction, I think we all would agree that we're not going to be in a very good place. We're going to be in a much worse place than we are already.
Yeah, I mean, I would love to see I would love to see in 6 months, whatever, and talk to Horace and say, has there been any even slight meaningful change in the disparities of care? Because as you started to talk about that, I remember, way back to one of the first things you said, I wasn't having spent so long in healthcare, and at one point in an area that served underserved communities, nothing about the fact that the infection rate, the deaths, the hospitalizations were happening in underserved communities of color. None of that surprised me. It horrified me. They've been writing about disparities of care for you could have predicted this. That this was going to happen.
Well, Justin, it's going to be, I believe, as a scientist, it's going to be repetitive. We're going to see more of these kinds of things if we don't address the underlying issues, because it is the structural, institutional culture that keeps on bringing these things back over. Look at our country, where, again, if we had acted with the proper mitigating resources 8 months ago, we would have lost. The scientists predicted this back in March. In this country, we should lose maybe 50,000 Americans. We've lost over 500,000. And let me not be political, but go back and look at what the finest medical journal in the world, the New England Journal of Medicine, read its editorial 5 months ago when it said about death in a leadership vacuum. This pandemic is not just biologic. It has ramifications in our society that we need to address. If we don't, it's going to repeat itself.
I just want to share one quick thing. We have a limited amount of time left, guys, but I just want to share with you, because we're talking about just the influence that you might have upon people who are watching you right now, wondering what you're going to say and how you're responding to. And I'm going to go back now to where we began on the issue of COVID vaccines. But this is a Facebook posting that's been, people are watching what we're discussing here. I decided to trust the vaccines after I heard Bishop Smith speak about it. I wasn't talking about any vaccines, and I haven't taken any vaccines, and I'm not sick. I haven't had a shot yet, but I decided to trust them after I heard him talk about this. Somebody else said, I'm not anti-vaccine. I'm just uncertain about a vaccine that was made so fast, and that's alarming to that person. These are some of the fears that people have, that perhaps through direct contact with people such as yourselves have a chance to at least provide answers. You may not be able to give them the answers that give them all that confidence that they're yearning for, but I wanted to let you know that people are already talking about what you're talking about.
And that's why I said at the very beginning, I think our government and people who are in charge should have invested more dollars into education about the vaccine. I encouraged my congregation back in March, and it's mainly African American, to join the study groups that were studying the vaccines. We had people at Northwestern, U of I, and everywhere from our church saying that Bishop Smith told us to sign up as a study participant in this study. And I meant that because I knew that if we didn't do that, then they could develop a vaccine that was not effective in us. So again, we send the people, look, we didn't do this willy-nilly. I did research for months looking at how the vaccines develop, why so quickly. And I will tell you, no steps were cut. But the U.S., to its credit, put in billions of dollars up front to assure these companies they would be paid whether or not the vaccines worked. That's why they were able to truncate the process, but not skip the steps. And the vaccines are all safe and they are effective. That is just the truth.
Bishop Horace, talk about that stat that you talked about right before we went on camera, the 1%. That could be important for people to hear you talk about.
Which 1%?
You said that right now the latest study was that of those vaccinated, less than 1%.
It's not a study. It's, if you look at the statistics,
the stats,
over 171 million Americans have gotten at least one dose of the vaccine. Around the world, over 710 million people have been vaccinated. Less than 1% of those numbers have gotten COVID. So to say that it's not effective, you have to laugh in the face of logic. All of these people have been vaccinated and they're not getting COVID, but there are people dying every day with COVID and they are not vaccinated. So that is a stark difference to say to people, if you value your own life, you need to get vaccinated. Why? Because you want to be safe. And the other piece to that is that we're seeing these variants. What you don't want to do is to wait, and then you get a variant of the virus that the vaccine doesn't work against. So waiting and taking time to wait puts you in higher jeopardy.
Folks, can you hear me?
We can hear you now.
Okay, there we go. Yeah, I think you lost me for a split for maybe 30 seconds there. There was a little Wi-Fi hang up there going on. Yeah. We're at our time, guys, and I just want to thank you so much for being a part of this today. Dr. Bishop Horace Smith, Rabbi Wendy Gephan, Justin Lombardo, and I'll give a shout out again to Gregory Abdullah Mitchell, who was unable to join us, but we so appreciate the different faith communities coming together in this. Thank you, guys. Thank you for sharing your thoughts. I hope you've helped to add some light here to minds that are looking for wisdom. And we do look to you as leaders for that purpose. And it's encouraging to hear faith groups working together and organizations working together as brothers and as sisters. So thank you so much for joining us today in our town hall. I want to also thank Deanna Palomar, our Vice President of Community Engagement, who helps to bring us all together, does such a wonderful job. And thanks to all of you for watching today. We so appreciate you. We hope if you've had questions, we've provided you with some answers, and I know there'll be more to come. We'll be here. And hopefully we can get back together again, like you were suggesting. We should do that. Absolutely. Thanks so much. Have a great day, everyone. Thank you. Stay healthy and well.
Let's exchange phone numbers.
Blessings to you. Yes.
We can get it from Deanna.
Deanna has all our numbers.
She's got to send us the numbers.
Thank you very much. Thanks for joining us.
Take care.